Thank you, moderator. Thank you so much. The lights are so heavy. EIB President and my good friend, President Nadia Calvino, Excellencies, esteemed guests, dear colleagues and friends, good afternoon, and it's a great pleasure to be here. And my thanks to President Calvino for your invitation and for your strong partnership and leadership. I'm also delighted to see former President Werner Hoyer here in the room, and I'm really pleased to see how the relationship between WHO and EIB that began under his tenure is now going from strength to strength under President Nadia. Since 2020, WHO and the European Investment Bank have worked hand in hand to advance global health, and together we have achieved remarkable progress. Through our collaboration, we have established new financial instruments to support critical health priorities, including polio eradication, primary health care, antimicrobial resistance, and malaria. I think President Calvino has said some of the partnerships, and you will excuse me if I repeat. We have brought together a diverse group of partners, from philanthropies to multilateral development banks, to drive innovative financial solutions for global health. Thanks to the leadership of the EIB, our partnership has expanded to include other multilateral development banks. Last year, the Islamic Development Bank and the African Development Bank joined WHO and EIB to establish the Impact Investment Platform, an initiative aimed at mobilizing 1.5 billion euros in investments for primary health care. The Health Impact Investment Platform marries the financial muscle of multilateral development banks and WHO's technical expertise to strengthen primary health care, which is the foundation of universal health coverage. The platform is already operational in Burundi, Ethiopia, the Gambia, Guinea-Bissau, Kazakhstan, Maldives, Morocco, Senegal, Uzbekistan, and Zambia, and many more countries are coming online. We have also introduced an innovative financing instrument of $500 million that links funding to performance for polio eradication. This was made possible through the collaboration of the Bill and Melinda Gates Foundation, the European Commission, and UNICEF, and with of course, EIB leading. In 2024, EIB funds enabled UNICEF to procure over 600 million doses of oral polio vaccines to support the response to cases of polio in more than 30 countries. The benefits of these grants go far beyond polio in strengthening immunization systems and expanding essential health services to address many other health needs. As part of the Global Gateway strategy, we're also working with the European Commission, EU member states, the EIB, and African partners on the MAV Plus initiative, which aims to support local manufacturing of vaccines, medicines, and health technology in Africa. As you know, one of the key weaknesses exposed by the COVID-19 pandemic was inequitable access to vaccines and other medical countermeasures. So the MAV Plus initiative is very important for addressing this weakness based on the lessons learned from the pandemic. And just today, we announced the latest project in our partnership, a 10 million euro contribution to re-establish the Central Public Health Laboratory in Lebanon and expand access to essential medicines. This grant will help Lebanon to detect, prevent, and respond rapidly to outbreaks of infectious diseases, and will also strengthen primary healthcare centers to supply medicines for 50,000 people with diseases, including diabetes, cardiovascular issues, and cancer. We're deeply grateful to EIB, especially to the President, for this generous grant, which will help strengthen Lebanon's health infrastructure at a critical time. WHO very much values our relationship with the EIB, and we look forward to deepening that relationship in the months and years ahead. Our teams are now working to develop new financial solutions to expand our partnership and strengthen our support for countries and expand the list of countries which I have already outlined earlier. I also thank the EU Commission, President Ursula von der Leyen, and the Team Europe for their strong and steadfast support for WHO and global health. We very much hope that health will remain a high priority in the Global Gateway Strategy and in the next multi-annual financial framework of the European Union, because investments in health are investments in competitiveness, innovation, and economic growth, as the theme of this forum indicates. My friends, I know you're all interested or expecting me to say something in what I have to say about the announcement by the United States that it intends to withdraw from WHO. So let me say a few words, because some of you have asked me earlier. We believe this decision is a lose-lose-lose. It's bad for WHO, but it's also bad for the United States, and it's bad for the world. Among the reasons given in the executive order for the US withdrawal are that WHO has failed to institute urgently needed reforms, and that the US contributes disproportionately more than China to WHO. In fact, over the past 7 years, we have implemented the deepest set of reforms in WHO's history to make us more effective, efficient, and impact-driven. Of course, change is a constant, and we have to continuously improve, and we would be happy to accept more changes, and we should. And one of the main areas of reform in the past 7 years has been financing of the organization. When we began our transformation, we identified, this is 7 years ago, our over-reliance on a handful of traditional donors as a major risk. And we have made several steps to broaden our donor base and mitigate that risk. We established the WHO Foundation to access new sources of funding, including the private sector. Last year, we conducted the WHO investment round, which helped to mobilize resources that we need to implement our global strategy over the next 4 years. And most significantly, our member states agreed to progressively increase assessed contributions to 50% of our base budget, which will make our funding more predictable, flexible, and sustainable. Together, these changes will transform WHO's financial stability over the long term and reduce the burden on traditional donors. So if this is what the US wants, that's also what WHO wants, broader donor base to have sustainable financing. So this cannot be a good reason to leave WHO. At the same time, we're taking additional steps to address the crisis we face now with a three-pronged approach. First, we're tightening our belts, realizing efficiency gains, and prioritizing to ensure we focus our efforts and our resources on the most critical programs that deliver the biggest impact in countries. Second, we're working to mobilize resources using instruments we have developed as part of our transformation. And third, we're working to engage the US, and we would welcome the opportunity for constructive dialogue and hope they will reconsider. Meanwhile, we're continuing to work around the world to serve our member states and the people of the world. As we speak, WHO is responding to outbreaks of Ebola, Marburg, Mpox, and more. We're delivering humanitarian aid in Gaza, Sudan, Syria, Ukraine, and elsewhere. And we're supporting the rollout of malaria vaccines. We're working to eradicate polio. We're expanding equitable access to life-saving medicines. We're strengthening the foundations of health systems, especially primary health care, as I said, in partnership with EIB. We're supporting countries to promote health and address the root cause of disease in the air people breathe, the food they eat, the water they drink, their lifestyle, and the conditions in which they live and work, and so much more. WHO is a unique organization with a unique constitutional mandate, a unique global footprint, unique global expertise, and unique global legitimacy. Like the United Nations, of which we are part, WHO was born in the aftermath of the Second World War, in the recognition that the only alternative to global conflict was global cooperation. Our Constitution was the first instrument of international law to affirm that the highest attainable standard of health is a fundamental right for all people without distinction. But the writers of the Constitution went further in affirming that the health of all peoples is fundamental to the attainment of peace and security, and is dependent on the fullest cooperation of individuals and states. In other words, health can be a bridge to peace. In a fractured world, health is one area in which nations can work together across ideological and economic divides. Now more than ever, our fractured world needs a common cause to bring it together, and health can be that common cause. Health is not only a byproduct of peace, it can help to bring it about. Health is not only an outcome of development, but the means. Ultimately, health is not a luxury for the few, but a right for all. That's the right for which I and my WHO dedicated, committed people, honored to call my colleagues, will continue to work every day with the support of the EIB and other partners. Once again, I extend my sincere gratitude to President Calvino. I'm proud to call her my sister Nadia, and your colleagues at the EIB for all the support and specifically for your leadership. And thank you for your partnership and your commitment to a healthier, safer, fairer, and more peaceful world. I thank you, and thank you for this opportunity again.